session, so get ready for a dose of inspiration. Our keynote speaker today, Christophe Joquet, is a global thought leader at the crossroads of health, marketing and technology. As an internationally recognized author and speaker, Christophe challenges business leaders to think beyond profit and put health and well-being at the heart of their strategy. His mission, to make the world a healthier and happier place, one bold idea at a time. Let's give a warm welcome to Christophe.
Thank you very much. Yes, so my name is indeed Christophe Joquet. Where is Vivian, by the way? Is she left? Ah, great presentation. It was not the demotivational speech. I really liked it. And I will piggyback on that because I call myself a health business expert, which means that I work with companies around the globe on trying to make health innovations work, often related to health experiences. And I think the one slide you mentioned, Vivian, that was related to the patient experience is basically my only experience that I have in clinical trials. I'm not an expert in clinical trials. I will not talk about clinical trials. But the one experience that I have has to do probably with your most important slide, the one with the buttocks of the baby toys. Because I was asked by a pharmaceutical company to evaluate the patient experience, mainly related to the informed consent, which was a simple exercise. Patients were paid quite gigantically. I mean, it was a nice payment, let's say, to evaluate in a very simple way the informed consent. They needed to put a green dot when they found a part in the informed consent good, and they needed to put a red dot when they found a part of the informed consent bad. How many pages does an informed consent have? 44. How far do you think the patients went in evaluating the informed consent? Page 3, exactly. After that, nobody did. So they didn't care about the money anymore. And those are people that were asked to give their valuable inputs. That was one of the exercises that I did that was really related to how can you really change the patient experience in clinical trials, whether it is keeping them engaged or whether I'm keeping them or getting them started. And today I will not talk specifically about the clinical trials, but I'll try to give you a broader inspiration that maybe might help you to think about the patient experience. Now, to a little bit introduce myself a little bit more, is that there's one thing that really drives me in everything that I do. And I will ask you a question to see if I'm still on the right path, and that is, who does not want to be healthy and happy? There's always one funny guy in the room. Not this time. So this is what I really truly believe. I think all of us want to be healthy and happy. It's basically the most important thing that we own. It's the most important thing that we have in our life. And that's why every day what I do is I look at the changes in society, I look at the changes in technology and the changes in business, and look at how they impact our health and well-being. And also the opposite, I look at how we behave, how we go about our health and well-being, and how that impacts trends in society, trends in technology, trends in business. I write newsletters about it, and then they eventually end up in books. I wrote 2 books. One is Healthusiasm, which I will be talking about primarily today, and the other one is the transformation economy, or the health economy, if you will. Healthusiasm is really about how does it come that people today are more than ever occupied with their health. What does that mean for you, companies, and how can you actually do something with that? Because this is, to me, if I talk to healthcare, I always say this one thing. Healthusiasm is the biggest opportunity for healthcare. It's also the biggest threat. You'll see that at the end of the presentation. And the second book goes even further. It looks at the whole industry and the whole economy to really help companies get some value in there. Whether it is healthcare companies or supermarkets, I work a lot with Colruyt, for example. I work with Proximus, with Ransom, with a lot of companies who previously had no affinity with health, but today really want to become a health player. So I do health business innovation, I do inspiration sessions, I give some strategic sessions, and I also work with hospitals to actually accelerate the implementations in about 27 hospitals in Belgium. That's the introduction. Back to Healthusiasm. The fact that people today are more than ever occupied with their health, right? Now, if I tell that to people, there's quite some people that tell me that it's always been that way, right? Even in the 2000 in the old Greek times, 2,000, 3,000 years ago, people were praying to the gods. They were bringing offers because health was that important. So what has changed today that suddenly people are doing more? And for that, I need to go back to my childhood. Who knows this person? Lovely. Last week, I just did a keynote for an audience with nobody older than 40 years old. They didn't even know who it was. I was surprised. But Jane Fonda, what happened in the 80s is that suddenly people started doing exercises at home because they wanted to have an impact on their health. This was the first time that this happened. The first time that people realized that we can do something about our health ourselves, right? This is something that changed radically because just previously before that, cigarettes were sold like this. Or you can even go to a hospital and bedside, you could buy cigarettes. This is not that long ago, right? Most of you might have lived it. But ever since the 80s, the number of people that smoked dramatically went down. And that was really the beginning of the Healthusiasm trend. This is the number of actions that people take to have an impact on their health that dramatically changed. Of course, it's not just that. It's not just Jane Fonda. There's more evolutions that had an impact. And I want to talk to you about 3 major evolutions that really did this. Because if you understand these evolutions, it might help even maybe to think about how can we change our clinical trials, how can we have a bit more different view of our patient. And obviously, the first evolution is technology. Technology has a major evolution, major impact. There's 4 phases that we can see. There's the information, there's the social media, technology, and now we have AI. And I'll give a little bit of context just to make sure that you understand what we're talking about. This is probably not too new for most of you, but people go online to find information. And the reason is, and that's Dr. Google that changed everything, and the reason is because they really want to have control over their health. We saw that very heavily during this period, which you might know, COVID. People wanted to go online to find information about what is the best thing for me. These are the Google searches for face masks, immunity, symptoms, whatever. They really wanted to understand it. So we were dealing with a pandemic. At the same time, we were dealing with an infodemic. People were looking for information that was not always correct. But this is what Dr. Google did. Dr. Google really changed that. You need to realize that before Dr. Google was there, the information on health was completely possessed, owned by physicians. We didn't know anything about our health. So when Dr. Google came, it's pretty logic that people went online to understand things left and right and have that searches on what does it mean, what is diabetes type 2, and is it really uncontrolled or not? I mean, they really wanted to understand that. And so ever since COVID, we saw something that was already happening for 20 years radically accelerate, is that people really wanted to have an impact. Everyday decisions were based on the impact that it might have on their health. That is the information part. The second part has to do with social media. If you look at people that have some sort of contact or follow certain healthfluencers or medfluencers, 93% of them say that it changes some habits in their lives. 93. If you look at chronic patients, they would even change habits that impact their own disease. Almost half of them. This is how, actually the healthfluencers and the medfluencers are the most trusted influencers on social media today. More than anybody else. This is the reality today. And it's not just social media. I mean, I'm pretty sure that all of you had at one point asked questions or provided answers related to some health issues or health elements from other people. 40 years ago, in the 80s, that was not happening. Nobody talked about their health to others. That was secret. That was privacy, what we called then. Right now, we just openly talk about it. We go online. If you look at the Facebook groups, I don't know if anybody on you are still on Facebook, which is basically the first virtual home care. But what we see is that you have about 2,500 breast cancer groups online. And the reason why people do it is because they want to share, they want to learn from others. There is this social change that we see that people want to learn from each other. And obviously that leads to this kind of difficult situation we're in, is that we used to trust science, now we used to, or maybe people tend to trust a lot more the social authority. If some influencer tells A or B, then maybe Z is not right because this is easier to understand and this will this will be the thing that we believe in. We saw that's very hard again in during COVID. But nevertheless, information is being shared on social media more than ever. People want it, people are looking for it, and it has a major impact. Same goes for technology. 1 in 3 has wearable health trackers, 1 in 2 has health apps. If I look around, it's probably even higher in this group. But the thing about it is not just the fact that they exist, it's the fact that it gives us a lot of power. You know, these devices, and I'm just showing specific devices that has nothing to do with health here, but we are able to buy devices that previously were only reserved for professionals. The devices that we have on our arm, the devices that we can buy, are for professionals these days, and we can buy them at a reasonable price. We can learn how to use them by going on social media, YouTube, whatever. And if we really want to use them, for example, to make music, we can immediately find our customers on social media as well. This is exactly what The Weeknd did. Who knows The Weeknd? It's also an idea to see who's older than 40 and who's younger than 40. But the thing is, The Weeknd is somebody who's made music in his own bedroom, created 3 albums in 1 year, put it on his own website. The only thing you can see was the 3 albums. You can listen to it. He put it a little bit on YouTube. Suddenly Drake liked one of his videos, and he became one of the biggest pop stars ever, signed by Sony. They didn't even change his music that much. It was so well mixed because he had professional gear in his bedroom that allowed him to make that great music. He wanted to become a singer. He became a singer. And that is the power of technology today. It empowers us to become who we want to become, which is the same with running. Running is probably the oldest sport ever. You put your shoes on, you start running, right? Tim? This is what you do. But this is the oldest sport. What we see today is that there's more people than ever that actually persevere in running. And why? Because of the running apps. It helps them to persevere. It helps them to stay motivated. And it's not just the running apps. If you look at all the technology that is available, you have music, you know what shoes you need to wear, you can do some tests for your foot, you have specific clothing for when it's cold, when it's warm, when you're heating up, when you're sweating, whatever, pressure, muscle compression things and all that. There's AR chasing games, there's a heartbeat, oxygen, HRV, I mean, all sorts of bioparameters. Metabolism can be analyzed while you're running. You can see whether there's salt, the amount of salt that is in your sweat, whether there's sugar, what you need to drink, when you need to drink, how you need to drink, in a way that basically running has become a personal science. Everybody who runs a marathon, except for Tim, they do some clinical trials themselves just to know at what point they need to optimize their performance. And we can do things that previously were basically impossible, right? We never thought that we could run a marathon in under 2 hours, talking about ambition, but it did. It was done thanks to technology. And one big part of the technology was these kind of shoes. And everybody can buy them. This is professional gear, but you can buy them if you have 300 euros, of course. And the key behind these shoes is that it lowers your time with 2%. At a certain point, they were even forbidden in the official races. But this is how technology has changed. It allows us to really become who we want to become. If you want to become a runner, if you want to have higher performance, this is what we do. And we see the same thing happening in health, right? Patients used to be people that were running around with these tin and pill boxes, and the only thing that they needed to do was remind themselves to take a pill. That's the only thing. And then came Dr. Google, providing them with information. They became informed. Sometimes they became empowered after the diagnosis. But today, really, people want to actively manage their health themselves. And these pill boxes have turned into digital products. And we have more and more products like this that are used by 100 million of people. During COVID, this device was nowhere to be found for 2 years long, because everybody wanted to have one at home. This is what we live in. Hundreds of millions of users are using Apple Watches, which is a medical device for certain things as well. So we see these professional devices becoming tools of all of your patients at the same time. And the fourth evolution is, of course, AI. If you look at data in the States, 32% go online asking ChatGPT for health-related questions. I think this is data from 2025. I think it was from May or something. I think if you would ask it now, it's probably doubled easily. Everybody goes online to find information. And in the end, I think if you look at how they score on the official medical tests in the UK and the US, they scored 90%. There was a lot of criticism because this is multiple choice and open answers is not the real messy stuff that is happening in the messy conversation that is happening in a consultancy space with an actual physician. But that is even challenged now. OpenAI created HealthBench, which allows you to really evaluate the answers from AI tools in a way that it is a messy conversation as well. So the messiness of having an interaction with an AI is included in these benchmarks that OpenAI is now putting out. And what you see is that overall, the average of AI is scoring as well as physicians today. So it's not a coincidence that all of these companies that you see here, of which you might know quite some, all of them are creating virtual doctors. All of them. The best one, I think, is in China right now. It's called Ping-An-Qingji. Somebody told me that it is also called Ask Bob. And it's pretty cool, actually, because what they did is they copied real physicians into that tool. And obviously, it could help you with medication reminders. It might give you some interpretation of medical reports. But you can also have a real personal consultation with them. In China, this is very important because there's a dramatic shortage of physicians. If you want to see a physician, it takes years almost. That's why in China there's also a lot of traditional Chinese medicine that is still used because people cannot see a physician. This is one of the ways of solving that. And it's the biggest insurer in China that puts this on the market. And it's not that far-fetched because if you look at digital humans being used by the NHS, WHO, or even simply in the Netherlands, they exist. They might help you with specific things like flu vaccination or rheumato questions, but they exist. They don't have even an LLM and ChatGPT type of solution behind it. It's just a very simple neural network, but they exist today. Now imagine if you add the Samsung virtual humans on that. This is an image from 3 years ago. Samsung is building this. This is not a real human, this is a virtual human. All of this allows us to have more impact and have immediate contact with the physician. And this is the technological evolution that leads up to what I call the Healthusiasm trend. This is what we see happening. This is the technological evolution. Now, a lot is happening around AI. I heard that there's already some discussions and presentations here today. I also have one in my repertoire, if you will, where I really explains how the impact of AI is such that it will radically flip the millennia-old dynamics in healthcare upside down. If physicians used to have all the information and all the tools, with AI that will radically change. Every patient will have basically all information and access to major tools, not surgery for quite some time. It won't happen that quickly. But there's a lot of solutions that patients will be able to make themselves or apply themselves without even going into the healthcare system. That is the first evolution. The second evolution has to do with the psychological evolution because you can have a ton of technology out there, but why would people use it? And there's one big reason why people are using it today, and that has to do with how our needs has changed. Our needs have changed dramatically. Our basic and our social needs have radically been fulfilled in today's society. In the Western world, that is definitely so. And if you look at the Maslow pyramid, what we see is that people go to the top of the pyramid, which are the aspirational needs, the self-actualization needs. People want to become the best version of themselves. And I always try to explain that to people by referring to my dad. When my dad went on retirement, he said this one thing to me. He said, now it's time for me. Now I will do the trip that I always wanted to do. Now I'll do the hobbies that I never got the chance to do, right? If you ask youngsters, and if I look in the room, most of you are young enough. if you ask youngsters, they won't wait until retirement to do the things that they wanted to do. They'll do it immediately right today. They will turn that hobby into a job. They will take a sabbatical just to travel the world a little bit. This is what youngsters do. This is the impact that we see today because people want to become the best version of themselves. They are very aspirational. Now, there's one thing I need to explain about aspirations because there's this thing that we have in our minds. Aspirations has to do with priorities. Aspirations has to do with dreams and has to do with values. Okay? But very often we think of it in this way. We think of aspirations as being, how can we improve ourselves, right? How can we have more energy? How can we look better? How can we be more creative, smarter, whatever? It's always about improving. But that has changed quite a bit because it's definitely since COVID actually. Because it's not just about becoming the best version of yourself is not just about becoming better. Sometimes the best version of yourself is just being who you are. It's okay to be okay. And so all the aspirations that we used to think about have become very much moderated. It's not just about improvement, it's also about prevention. It's about acceptance. It's about enjoyment. These are the aspirations that sometimes we have. It's not always about, I want to be smarter, I want to look better. It's just about maybe it's okay just to be who I am today. It's one of the most important lessons that I gave to a lot of pharmaceutical companies, definitely in oncology. They always talk about, you need to battle, you need to fight, you're a warrior. But most of the patients haven't even accepted yet that they're sick. So how can you talk about improvement if acceptance is their first aspiration? This is very important. In my last book, I really explain what these aspirations are, and basically, the second book was written because a lot of companies came to me, yeah, we understand that people want to be healthy and happy, but what does it mean? And I was like, yeah, what does it mean? It's very fluffy, right? And so for 4 years, I really investigated and researched what is the level just beneath. And I came up with these 24 universal values, desires, aspirations, if you will, in life. And I'm pretty sure if you look at these lists, you can find the ones that are most interesting, triggering for you. This is the reason why you want to be healthy and happy. If you ask, I'll give a cliche. If you ask somebody 35, just had or has 2 kids, just had a promotion, parents still alive, had a lot of friends still from university, she wants to run, she has a partner still, she has her friends from high school maybe even still. So she wants to be a good mom, a good partner, a good friend, a good new friend for the parents of school. She wants to be engaged in school. She wants to be the good boss because she just got promoted. Her reason for being healthy and happy is energy. She wants to have the energy to fulfill all those roles. This is what we see today. People have all these aspirations more and more, and this is the driver of wanting to be healthy and happy. And it works really well because if you look at the supplements company, you can find for every single aspiration I put on the board there, you can find a supplement. Hair loss, I want to avoid hair loss, prevention, right? I want to boost my confidence, there's a supplement for that. I want to be more relaxed or I want to have more energy. There are supplements for everything. And the reason why they work so well these days, and why so many startups are focused on supplements, is because they fulfill these aspirational needs. So patients, basically humans in general, they're not waiting for the thing to explode. They've become not just reactive anymore, they've really become proactive. And you can see that even in the data that we see in supermarkets. Nielsen IQ is the IQVIA, if you will, from supermarkets. And they look at data, do a lot of research, and what comes out of it is that half of the population really takes proactive health decisions every day. Half of the population. If you ask people, did you take care of your health more than the year before? 9 out of 10 will say yes. This is how important it has become. So we have this psychological evolution where people more and more have these aspirational needs, for which I also obviously have a keynote. Third evolution of the Healthusiasm trend has to do with the economy. Because if 50% of the population now says, you know what, I'm interested in health. If 90% says I'm doing more than last year, then there's a lot of companies that say, ooh, this is interesting. And so they start playing in it. And it's not that stupid because if you look at the marketing guru in the world, is Seth Godin, What he says is that marketeers, they help people to become the person they dreamt of becoming. So marketeers really make sure that these aspirations that people have are becoming real. And so it's not a coincidence that these aspirational needs that more and more people have will become the future of consumerism. Already in 2015, there was a trendwatching.com, the biggest trend watching agency in the world basically. They said self-actualization or the aspirational needs will become the basis of every purchasing decision out there. And only a couple of years later, again, Nielsen IQ said that health and wellness is the single most important consumer force out there. Accenture followed that up and said, you know what? Every business is a health business. Havas said, if you are a brand, you need to make sure that you improve the health and well-being of your people, because 71% of consumers out there are saying it. Go online, look at Google and the search terms for self-care. It quadrupled between 2005 and 2015 to then again double afterwards. Wunderman Thompson said that self-care is basically the biggest trend we've ever seen. It turned into a $6.3 trillion business. Now, if you're not sure how big that is, it's that big. Obviously, for some reference points, these are the other industries. So consumer tech, pharmaceutical business is 1/4 of the wellness industry. 1/4 of the wellness industry. Knowing that pharmaceutical business is 80% reimbursed, it means that people are willing to pay 20 times more for wellness than for pharmaceuticals. If you say to me that patients are not engaged, it has to do with your product. It has not to do with the fact that they don't want to be healthy. It's really the way that you bring your experience to them. It's only food and beverages and the whole health expenditures are bigger than the wellness economy. Now, on top of that, all these blue bars are actually the decisions that are driven by health consumers. And what you see is about 20 to 30% in every industry is already driven by health and wellness decisions today. This is how big it is becoming. And indeed, you see Ranson is a ventilation company for ventilations you put in your home. One of my clients, they decided 15 years ago, you know what? There's ventilation products that will fight on price. We are the cheapest one. There are ventilation products that say, we are the best one. We perform better. They say, we're not going to fight in those areas. We will say, we make your home healthy. All their products are called health boxes. They don't fight in performance. They don't fight in price. They just say, we make your home healthier. And that's been their positioning since 15 years. Mercedes-Benz in 2017 was one of the first cars together with Hyundai to focus on health. They had the Fit and Health car, was totally integrated with wearables, your agenda, the traffic jams, and it would adapt your car, lighting, the temperature, maybe some massage, all those things, if you felt stressed. So if you see that, oh, well, I'm going to be late for that talk here at PWC because there's a traffic jam, my car would then suddenly start giving me massages, put some music on, maybe some better temperature. Sounds funny, but that was 2017. In my last book, I have an entire chapter of every single car manufacturer is now focusing on health experiences in cars. Every single car manufacturer today. I like the left one here as well. This is Priya. This is a telemedicine solution, if you will, but also a pill dispenser. So you can call with your physician, you can call with your pharmacist. It dispenses the pill. You can even ask questions which are medically related. It's brought to the market by Black & Decker. Disney is on animations. Deleuze has a specific loyalty card for healthy products. What we see more and more is that many businesses are moving into that health space. And the equation where we say, you know, a consumer takes lifestyle decisions and a patient is involved in medical decisions, hopefully, that's no longer true, basically. First of all, don't ever say that patients and consumers are not the same person, because they are. We are all consumers and we are all patients. Right? We might have different needs in different situations, but our expectations are exactly the same. Right? This is one thing that I wanted to share. The other thing is that in between those archetypical decisions where we think that consumers only take, you know, lifestyle decisions and patients only take medical decisions, there's a lot more decisions that's happening. And this is actually the core of Healthusiasm. And if you look at supermarkets and you map all their initiatives on this map, you see that even in the consumer space, they go into the medical. Or even for patients, they help with some solutions. Albertson and Genomind is in the States. There's specific CNS products that react differently to different types of genomes. And so you can do a genomic analysis to see what type of medication you need to take. The test is sold in a supermarket. To be able to go to your physician and say, look, I did the test, this is the type of medication I will take because it has 40% more impact. These things happen. I did this for Collard, who has a major strategy on healthcare, for example. But even if you look at Apple, one single company, they are all over this graph. They go from lifestyle, which is more like fitness related, to some prevention, which is maybe the noise. But then you go all the way up to Apple Research, which is very medical. No wonder that the CEO of Apple is saying our biggest impact on society, on humanity, will be health. This is the one single that ever since Tim Cook came on board, he said the one thing that we will crack is health. We want to have a major impact on health. So that is the economic evolution, one of the things that I write about in my last book. So these are the three evolutions. We have economic, psychological, and technological, which basically explains how technology empowers us, how aspirations are our new needs and drives us, and how business supports us more and more. And so the equation where we think that the physician is at the center of the health universe is basically no longer true. We have lived already for a couple of years what I call a Copernican health revolution. And it's actually the patient that is at the center. And he has a ton more options than 20, 40 years ago. This is what we live today. And obviously the physician still remains important. But it's not the only source of information. It's not the only provider of solutions. And definitely with AI, that will change. And so that's why I tend to avoid speaking about healthcare. Because to me, healthcare is too much an on and off switch. You're in the system when you're sick, and when you're somewhat better, you're out of the system. On, off. That's why I represent Healthusiasm as this, because we're always occupied with our health more and more. It doesn't just stop when we are so-called healthy, because we want to be happy as well, and we want to maintain our health. And this is what we see with Healthusiasm. This is the evolution that Healthusiasm is bringing. So this is not a talk specifically about clinical trials, right? So this is not specifically for you. But I think you can see that you are dealing with patients, and that basically the patient is no longer patient. And I want to conclude my talk by talking about this, the fact that the patient is no longer patient. And I'm pretty sure you all work with patients, so you know the definition of the word patient. But I think it's really good and interesting just to go online and see, according to a dictionary, you know that book we still have where you can find words in. If you go online and you look for the word patient, what does it mean? Now, obviously this is not the noun, but if you look at it really closely, it almost describes healthcare. Because it's about waiting a long time. It's about dealing with stuff, right? And that's why I say the patient is no longer patient, because patients don't want to wait anymore. We don't live in a world where we are used to waiting. If you buy something on Zalando or Bol.com, it comes the next day, right? And if we lose our Visa card, it takes a week. Why does it take a week for a piece of plastic? We don't have that expectation anymore. And we don't have that same expectation towards healthcare as well, neither in clinical trials. So the patient is no longer patient. They don't want to wait. They don't want to have a bad experience. So maybe let's then look at the actual definition of a patient. And I don't think it's valid anymore. Because again, two elements. Receiving is not exactly what we're dealing with today. Patients don't just receive the 10 pill boxes are gone. people are actively involved in their health. So the receiving to me is too limiting. But also the medical attention, care, or treatment is too limiting because they do a lot more than just the medical care or treatment. That's why it used to be one of my most popular talks, the patient is no longer patient. And that's why I always say this. If you think about your end user or your end, the person that you involve in your clinical trials, this is the patient, and he or she is no longer patient. They actually have Healthusiasm. This is basically what I wanted to give you or inspire you with. If you have any questions or if you want to have the slides, I'm more than happy to share them with you. Just a quick promotion at the end as well. I have an end of year keynote which talks about all the innovation that we've seen in 2025, it's been a crazy year. There's been things happening under the radar that nobody really thought about, which radically is changing the future of healthcare. So if you have any questions, I'm definitely open to answer them. Thank you very much.
Thanks a lot, Christoph. Very inspirational. Any questions? No questions from the audience? May I ask one?
Yeah, sure, please, go ahead.
How do you see the impact on, we have a room full of clinical research experts, the impact that this will have on clinical research?
Well, I think one of the challenges, as far as I know, from working on a certain number of projects, is the engagement. Keeping people in clinical trials is, contradict me if I'm wrong, very difficult, very costly as well. And I think it will not get better if we don't optimize the experience. And the reason is because we have expectations, all of us have expectations based on all the experience that we have outside of healthcare. So the example that I gave about bol.com delivers to you the next day, we don't accept that it takes 1 week to receive a new Visa card, right? This is the type of thing that we are living in healthcare as well. So we need to think of not just the needs, but also about what are the expectations and how are these expectations changing with social media, Google, bol.com, AI, and so forth. And how can we make sure that people live the same experience when doing clinical trials? Because if that is not the case, they'll drop out. The core essence to me for engagement is providing the right value. And value is created by taking into account the needs and the expectations. I would also add the aspirations, but to keep it simple, expectations is one of the most important things.
All right. Totally agree.
Thank you.
Anyone else?